Welcome to our webinar this evening. I'm going to kick this off by making sure that everybody can hear us. It's a great topic today. I think you're going to enjoy this, everybody. We have a special guest today, a physician, who is going to be discussing the pros and cons of starting a business in healthcare. And so I think you'll find this very interesting. You'll be able to ask questions live during the webinar. So I'm going to show you where to do that here by going to the next slide here. You'll see a question box somewhere over on the control panel for GoToWebinar. And there's a little box there where you can actually type in if you'll type your city and state in there, I'll kind of read some of those out and we'll know for sure that you're actually writing that. Now I've got to get back and find out where my question box disappeared to here. There it is. Okay. So now let me get that back on the screen and I'll hopefully get that back on there just a second. All right. So here's the question box coming up. There it is. And as you can see, that has a place where you can type that in. And as you do that, I'll read that out and just make sure that everybody is actually tuned in and listening to what I'm saying here. So let me, again, I kind of lost it there again. So I'm going to get back over here and see where there's, okay. I wonder if okay, somebody doesn't have their speakers turned up. Okay, there we go. All right, so I see Atlanta, Georgia, Fairburn, Georgia. I have Los Angeles, Fort Myers, North Carolina, Georgia. Here's Ralph in Broken Arrow. Beatrice is in Springfield. Well, good. All right, well, that tells me that the voice and the sound is coming through okay. So let me get back to the slides here and I'll introduce myself to you. My name is Patrick Phillips. I am the CEO and founder of American Business Systems. I'm the author of a couple of books that you can find out on Amazon.com or go to your local bookstore and ask for these books. And you'll find out a little bit more about those as you engage with one of our reps here at our office. The one on the right, for example, Cash Crunch to Cash Flow, is actually used by our licensees to actually market their services directly to doctors. It's a great marketing tool. Our guest today is Dr. Vicki Rackner, and I'm going to introduce her more formally here in just a moment, but she is the doctor that's going to be discussing today with you, answering my questions and yours about what is going on in the healthcare field right now and why this might be a good time to get involved in that as a business. Now, just so you know, American Business Systems has a totally cloud-based system, including a patient portal. We have an electronic medical record system that the doctor can use when seeing the patient. And we have a built-in clearinghouse in our billing system itself that sends the claims directly to the insurance companies. So it's not software that resides on your computer or on the doctor's computer. It's cloud-based, and of course, that's what a lot of things are going to nowadays. So we have a complete total training and support package. Basically, what we do is tell people, look, our only business as a company is not to do the billing for doctors, but to find people like yourself who are interested in doing that, starting their business in their home. Most of our licensees work out of their home, and then moving to offices as you grow larger and want to hire people. Now, our website is American Business Systems, absystems.com, absystems.com. And you'll find on the website a little button here called Take the Tour. The website itself has a lot of information, but that little button there will give you an electronic tour of the entire opportunity and give you more details about that. You can come visit us any time you want to down here in Fort Worth, Texas. Sorry that text is on top of the message on the bottom of the screen there, but you can see our address, 5751 Kroger Drive here in Fort Worth. Just let us know you're coming. We'll pick you up at the airport if you're flying in. You can spend as much time as you want here asking us questions, and we'll show you a demonstration of the system and introduce you to all of our folks here. If you're doing your due diligence on us as a company, be sure to go to the Fort Worth Better Business Bureau website. Just type in our name and American Business Systems, and you'll see that we have an A+ rating. You can't get a better one than that. Now, we do live training here in the Dallas area at a hotel. You stay at the hotel, and the training is at that hotel. It's only about 5 minutes away from the DFW airport. So the next one coming up is July the 13th, which is coming up here in about a month, I guess, 4 weeks from the other day. So be sure and to get back with your ABS rep. we are filling up that class. More than half the seats are already committed to. So if you want in one of these classes, there are only 20 people in each class. Be sure and get back with your ABS rep and ask them more about that. All right, well, let's see if we can get Dr. Rackner here on the line with us. I guess she's still behind the scenes waiting anxiously to get on here with me. Hi, how you doing?
Hello.
Thanks so much, Dr. Rackner, for being with us today. Let me tell people just a little bit about you, if you don't mind, because I know that you're a retired general surgeon and a nationally recognized expert, author, and speaker, and used to treat tens of thousands of patients, of course, over her period there of being in practice. And she's also held a clinical faculty appointment at the University of Washington School of Medicine. You eventually, I think, Vicki told me that you left the operating room at some point and got into other business-related, doctor-related businesses, helping doctors and medical stakeholders of all kinds interact with doctors more effectively. So thank you so much for taking time to be with us on the webinar today.
Well, it is my great pleasure, and it's especially a pleasure to support the success of people who are helping doctors at this time of need, and you offer a really important service, so it's really my honor and pleasure to be here.
Well, as you know, we've been doing this for about 21 years now, and we're just learning more and more that this seems to be the right time. You know, we're just timing is everything in any kind of business that you're thinking about getting into. And it just seems like the right time. I'd like to hear your own thoughts on that as to why, you've indicated to me that you know that this is a good time. Why is that people should be looking at the healthcare industry, especially medical billing, versus all the other opportunities that are out there nowadays?
The short answer is that there's an acute source of pain, and medical billers, your licensees, are the solution. So what's going on in medicine is that there are some big, profound changes with the Affordable Care Act. What physicians are seeing is rising costs, falling reimbursement, and a lot of them are saying, ouch, how am I going to generate more revenue? Am I going to go faster and harder on the hamster wheel, or am I going to do things differently? And the enlightened physicians are understanding that it's time to do things differently. But there is a whole another layer of complexity. There is this new coding system, the ICD-10 coding system. And if you read the medical literature, doctors are talking about this as really the tipping point. You know, if they were trying to manage their financial pain earlier, this is it. This is finally the point that they say, I've got to do something different.
Well, and that's the feeling that we're getting as we talk to people who go through our training here in Dallas and then go out in the marketplace and find that out from the doctors themselves. It's hard for some people to wrap their brain around the fact that doctors, are not, some of them, not wanting to do this billing inside their own office. It seems like the outsourcing is the big surge that's coming on. In fact, we found an article here I'll throw up on the screen recently that just came out in Healthcare Finance on their website about the fact that revenue cycle outsourcing is to surge in the next 5 years. Kind of explain to people what they mean here by this term revenue cycle. That's kind of a strange term to use for outsourcing their billing.
Well, it's a strange term for me as a doctor, too. And before I answer that, let me just say that doctors are wired differently than business-minded people. I mean, the listeners on the line are thinking logically with their cerebral cortex, their thinking brain about making an investment. But when it comes to money, doctors are wired differently. Patrick, remember that Shark Tank that we were talking about? A doctor went into the Shark Tank.
Yeah, just recently.
Just recently. He went into the Shark Tank. He had a great company. He was asking for $3 million for his medical device company. And I listened to his pitch and I thought, man, this is going to be a 5-shark deal. Then they started asking the questions. And Mr. Wonderful, Kevin O'Leary, asks about profitability and about revenue. And the doctor says, well, and this is what he says in the Shark Tank, I could make money if I wanted to, but that's not important to me.
The doctor said that, huh?
A doctor said that, but it was sort of like, this is how all doctors are feeling. So I see that, and I think that is a business-minded person, probably for the more administrative kinds, What I as a doctor think is, ouch, I am not making as much money. What am I going to do? Am I going to see more patients? And the honest truth is that most doctors really don't know enough about money to know what the solution for them is. They just know it hurts. And you are an obvious solution. So that's how doctors are thinking about it.
Yeah, I ask that question in every training class to the people that have worked. There's some people who come through our training that really have had some kind of connection to a doctor's office, and I ask them, how many of you think that doctors are good business people now? Not doctors, practicing doctors, but business owners, and hardly anybody ever agrees that, that they are, because, like you said, they just have a different mindset.
They really do. So for them, money is a tool that helps them serve in a bigger way. So for example, I have a friend of mine from medical school who has a neurology practice. I probably shouldn't mention the city. But anyway, as the economy dipped, she went into her 401k, her retirement, to fund her payroll so that she could keep her doors open. And finally, it got to be unsustainable, but that's not a smart business kind of move. And that is just so typical of doctors. They are dedicated to their patients. They really want the best for their patients. And the revenue that they collect is a tool that helps them do that, but they need help with that. And you might be the doctor's right-hand person. You might be the person that helps this doctor stay in practice. My friend Kathleen actually had to close her practice. You could be the person who keeps that doctor in practice and who keeps that doctor happy.
And we need that right now. Haven't you read? I've read that there's going to be a shortage of doctors in the near future, because a lot of young people are just opting out, not going the healthcare route, but some other route, because of all the changes that are happening right now.
Absolutely. So I think we're all served well when we have the choice of going to a physician in private practice. Now, when I got out of medical school, about 80% of physicians were in private practice. That number has gone down. I'm on a personal mission to help doctors who want to stay in private practice thrive in private practice, because I think we as a nation need to have that choice. And you could be the person who makes that difference for doctors. If they don't meet you, if they can't figure out how to solve this problem, their option that they're looking at is to close their practice or to sell their practice to the hospital and clinics. And for doctors, that is literally selling out. That's not something that they want to do.
Yeah, now you even sent me this article here from Physicians Practice that talks about outsourcing the billing and asking, is now the time? Seemed like there was one particular thing in that first paragraph there that you figured. They said something about, there it is, or perhaps the upcoming conversion to, oops, I went to the next slide, sorry, to ICD-10 has become the tipping point. What do they mean by that?
What that means is that, well, you know that old story. If you put a frog in water, in room temperature water, and heat it up, the frog's not going to jump out because they accommodate to the changes. So that's sort of what's been happening. But with these new changes, with all of the changes from the Affordable Care Act, and now this new coding system, that's it. It's like putting the frog in hot water and they want to jump out. So that's what this means. The pain has just gotten too great. I mean, an example that we were talking about recently is I love my dentist. And every year when I went to see him, he would tell me about this big filling that he said should be replaced. It wasn't causing any problems now, but down the road it could. And so he recommended some proactive changes. And I kept putting it off and putting it off, like so many doctors put off and put off managing the business of their practice. But the day I had a popcorn kernel underneath my gum and it set up a micro abscess, I was in the dentist's office that day. So this ICD-10 transformation is like that popcorn kernel. It's not some theoretical pain in the future. It is something real that's happening today, and that's inspiring physicians to action. But the thing is that there is a window. Physicians are going to be deciding, and like when my popcorn kernel abscess was cleared up, I was back to my new normal. And it's just like that here. Physicians are responding to all of these changes, the ICD-10, the changes of the Affordable Care Act, and they're going to make a decision. And this is your opportunity. This is the right place and the right time to really mine the treasures in the medical market. You can be that solution at this magical moment in time in the history of our healthcare system.
Well, you know what, that kind of makes sense that there is several things, the electronic medical records that doctors are being required to move to, and then like you just mentioned, this new ICD-10. Can you explain, I've got a super bill here, a fake one that I'm going to put up on the screen. Maybe you could explain to people why those codes are so important.
Those codes are everything. That's like the price tag on something when you go to the grocery store. So what I would do as a practicing physician, I always had one of these super bills because I outsource my billing. And so I would check off a procedure code and a diagnosis code. And those were the codes that determined how much I got paid for my service. And the difference could be hundreds of dollars depending on whether I chose these codes correctly. So some insider who really understands the nuances about how to code to optimize your revenue. I'm not talking about anything illegal or immoral. What I'm talking about is coding so that you get what you deserve. And that's the basic challenge. Doctors are not getting what they deserve. The coding system means that there is going to be a different way of describing what you do, which codes that you choose, that could make a tremendous difference in how much you get paid. I mean, how would you feel if you engaged in a transaction, if somebody were to pay you and you only got 70% of what you were owed? That would not feel good, and
No.
that's exactly the position that physicians are in.
And so they're using these codes now, but they're called the ICD-9 codes, right? And so these new 10 codes are coming out October 1st of this year, isn't it?
Absolutely. And so there's all sorts of subtleties, and I'm not positioning myself as an expert, but the way that you look at the global service that a doctor delivers can make a huge difference in the amount of fees that they generate. And so doctors need somebody to help them do this so that they get paid what they're owed. And this is a huge project. I mean, getting up and going and really understanding the ins and outs is kind of like understanding tax laws. I mean, I would never take on the mastery of tax laws myself. I go to an expert because I want to minimize my tax burden. Doctors want to optimize their revenue, and so turning to an expert who knows the ins and outs of these coding systems, they get it. We've been through this in the recent past. We know the pain. We know we don't want to invest in it ourselves. We want an expert.
Yeah, and the nice thing is that our cloud-based system that I talked about earlier has all the new ICD-10 codes already programmed into it. And doctors that are using our system can actually click one button to see the ICD-9 codes, the current codes, and then another button will show them the ICD-10 codes that they could use once those are in effect. So people don't really have to have any coding training. And we even have a service that our licensees can offer that we have certified medical coders who provide that service for them, for the doctors. So anyway, I have a quote here that I thought was interesting. It says, this is from the blackbookrankings.com. I don't know if you can read that. It's a little bitty tiny type right there. But it says, of all physician practices that are 1 to 5 doctor size practices with employed billing staff, hope to outsource their billing in the next 12 months, 42%. So I think that's great news for people who are thinking about getting into our business, because that's just the ones who admitted that they're thinking about outsourcing.
Absolutely. This is the right time. If you were to have a magic wand and create a market that is ripe for, profitability for you, this is it. Like, I can't think of any better business opportunity right now. This is the right place and the right time. And Patrick, let's remember, according to the U.S. Department of Labor statistics, 9 out of the top 10 highest paid professionals in the US call themselves doctor. So this is a market that has the potential for profitability, because remember, essentially you're going to be collecting a percentage of what the doctor generates. So if you're working with doctors who earn a significant income, you are going to get a percentage of that. So you're associating yourself with the top, and then being at the place of this tipping point right now, I mean, it's hard to imagine a better business opportunity.
Yeah, you hear that term window of opportunity. This one really truly is a window because, first of all, those codes come into effect this year. But then you got the tsunami of the Affordable Care Act and electronic medical records and all these other things that are coming down on the doctors as well. So it's like a tsunami that's just all hitting at one time, isn't it?
Absolutely. Absolutely. And let me just say, Patrick, that physicians kind of network like tropical fish. They hang out together, they move together in the same direction, and they gossip like teenage girls. So in the doctor's dining room, in the surgeon's lounge, doctors are talking about what's the problem and what's the solution. And the thing is that you get one delighted doctor client, you coach them about how to talk about this, you can get your phone ringing with other doctors who want to have the same kind of business success. So that's another really wonderful part about the medical market. A delighted doctor can be your advocate. Basically, they can be your sales force.
Yeah, we've actually had licensees tell us that, Dr. Vicki, that they went out and did what we taught them to do in our training class here in Dallas. They went out and did what we told them to do and got their first client, and then they just did a real good job for that doctor, made them very happy, delighted, and their business just grew from referrals. They never had to do any more marketing. So it really is one of the best businesses for referral, word of mouth referrals that I've ever heard of.
So let's just summarize here. Okay, so you have a market that is a huge market with people who generate high incomes, a pain point, and a potential to build a referral network. I mean, I've launched a number of businesses, and this is a dream business opportunity. Plus, you get to be helping doctors. I mean, and that helps the community. So you're doing well by doing good.
Yeah, it's a win-win-win situation for everybody involved.
Absolutely.
Now, I'm going to address some of the questions that are coming in. I'm looking at some of them being typed in here. One of them is from Julie. She's wanting to know if you know what percentage of doctors are in private practice now.
So there is large variation throughout the U.S. There are some cities that have a lot of academic centers. The national average is that there's about 40% of physicians in private practice today. But let's think about this. There's about 900,000 practicing physicians in the U.S. How many private practice physicians would you need in your community in order to have a successful business? And the numbers are not very big. So even if you are in a neighborhood totally saturated with academic centers, there's opportunity in any city in the United States.
Yeah, we've had licensees tell us that they literally got to 3 or 4 doctors and they didn't want to grow anymore beyond that because then they would have to maybe open up commercial office space or hire people, and they just wanted to keep it small. And that was earning them a good enough income that they didn't have to worry about big, huge numbers. Because I think most people think in terms of, well, I've to be a successful medical billing center, I'd have to have 20, 30, 40 doctors. Now, we do have licensees that have more than 100 providers that they're billing for, but they've chosen to go that route. Others have just kept it, small, which is good.
So the physicians who are in private practice now are there for a reason. They want to maintain their autonomy. And most of them are willing to do whatever it takes to be able to stay that way. So they are out actively looking for the kinds of solutions that you offer. You're going to be a trusted peer and a trusted colleague. There are very few people who know a doctor's financial truth. Some husbands and wives of physicians don't even really know what's going on in the office. So you are going to be a trusted peer of a physician.
Yeah, that's a good place to be in any community dealing with professionals. And of course, like you said earlier, they're professionals who happen to make a lot of money. So you're tapping into the money, the revenue cycle that they have and getting a percentage of that. So uh, here's an interesting question from Nikhil. I'm sorry, I can't read this. Nikhil looks like. How do you select the diagnosis codes for some procedure codes? In other words, how does the combination of diagnosis and procedure codes works?
So basically, it's kind of like the codes that you have on the produce when you go grocery shopping. You put the code into the computer, and it's not your job to know what the code is, it's the doctor's job. But knowing how to translate the current code that they're using to the ICD-10 code, that's where the value that you deliver comes in. So you're not going to be the coding expert in that way. You will not be selecting doctors' codes, but you will be offering information about how they upgrade. And as I understand, Patrick, that's electronic. That is something that the computer basically queries about, correct?
That's correct. In our system, when you get the diagnosis code from the doctor on the super bill that's up on the screen there, then the doctor puts that into our system. They see by pushing a button what the suggested procedure codes might be. Now, sometimes there's a choice there that they have to make depending on the description of that procedure code, but it's all tied together inside the system. That's why nowadays doctors don't really have to have, if they have our system at least through one of our licensees, they don't have to have a coder on hand because computers can do all that for them nowadays.
Mhm.
Yeah, now here's an interesting quote here from Via Code. They're a big coding company, and they say that the average physician could increase their monthly billing by about 30% if their medical coding was done accurately. You mentioned that earlier, that a doctor sometimes is coding, maybe they're scared of Medicare audits or something.
Well, I think the major problem, Patrick, is that they don't follow up on rejected claims. And the insurance industry, God love them, the insurance industry, they're smart business people. And they know that if they reject claims, they get to use this money longer. So they, as a matter of habit, will reject claims knowing the doctors will not follow up.
Yeah.
So many physicians, they just look at the rejections, oh, well, I'll just write it off, tax benefit. They don't have a system for following up on these rejections, and that's really where doctors are leaving money on the table. So if a doctor is thinking, I need to see 10 more new patients a week in order to maintain my revenue, that seems overwhelming. But if you know that with one choice, you could increase your revenue by 20, 30%, that's a much better choice.
Yeah, and we see that happen on a daily basis with our licensees because they're coming back to us telling us that very thing has happened. That the doctor, when they went in, maybe they were having $30,000 a month of revenue, and after dealing with their billing for a couple of 3 months, it went to $40,000. Well, that's because the coding got right. It got fixed.
And follow up.
Oh, yes, and follow up. Yeah, that's another big thing you mentioned that again, we go into doctors' offices who have a bunch of denied claims, and there's just too much going on. There's another 20 or 30 claims today, new ones that are coming in. So to go back and try to deal with the denials, the rejections, is just too time consuming and burdensome. And like you said, they'd just rather write it off and move on. But there's money in them there denials, huh? They could go
Absolutely.
after. And our licensees do learn to go after that and collect a lot of money that's just left on the table, so to speak. Here is, Valerie's asking the question, so do you need to have some knowledge of coding? It never hurts to have some knowledge, but Valerie, I think Dr. Vicki would agree that once you start doing billing, let's say for a podiatrist, the podiatrist might use maybe a dozen, 2 dozen codes on a regular basis, even though there's thousands of them. He just uses certain ones over and over again, primarily. So you become familiar with those and almost have them memorized within just a month or two. So,
Absolutely.
so
Absolutely.
your knowledge comes from on the job training, I guess you'd call it.
Absolutely. And it's always possible to sort of get an ally to, doctors like to work with people who know the secret handshake, but you don't have to learn the secret handshake from a doctor. You might have a friend who's a nurse. You, so you probably want to have somebody in your corner, and maybe it's even your first client who sort of becomes your advocate. And you definitely want that, but there's only a limited amount that you need to know, and you're going to quickly acquire that.
Let's see. Nikhil says if doctors need help in selecting the combination of diagnosis codes and procedure codes, how can we help? I kind of mentioned this earlier, but it kind of went by real fast, Nikhil. We do have certified medical coders that are available to you as a licensee that can look at the doctor's current codes and suggest the codes that the doctor could or should be using. So that's a service that you offer to the doctors for a fee, of course, as a part of your service to the doctor. Hey, Dr. Vicki, do you agree with this quote that's on the screen right here? Do you think that doctors spend 20% of their time on non-clinical paperwork? I guess that means billing and administrative stuff.
Absolutely. And do doctors hate it? Absolutely.
Yeah, I
I
bet.
wanted to treat patients. I don't want to treat paperwork. And when I ran my office, basically my staff knew that their job was to take care of everything so I could just focus on patient care. Physicians hate this. So what they want is they want a smooth running practice. They want cash coming in so that they can continue to stay focused on the things that they do well, which is patient care.
Yeah, I've walked into my own doctor's office and I look back there and there's, half a dozen people doing all kinds of stuff and a lot of them are messing with the paperwork that has to do with filing the claims to the insurance companies. That's not productive. To me, that's not their main core competency. They should be focusing on getting more patients in to see the doctor. Isn't that where they make their money?
Absolutely. It's like any of us could change the oil on our car, but why not let the expert do it so that you can do what you do most profitably? And if you think about the hourly wage of a physician, if you were going to break it down, and the value of their staff time, it just doesn't make economic sense to keep it in-house. There's just too much risk. And let's talk about the deepest fear that physicians have, which is embezzlement. I am a contributing expert to a publication called the Journal of Medical Practice Management. So I talk with the editor. She says that every single issue has to have something about fraud protection or embezzlement because this is something that physicians are worried about. I was just quoted in Physician Practice magazine about embezzlement. And they start out with the story of a doctor's office that lost over $700,000
Yikes.
from a trusted office manager. How was she doing it? The co-pays. She was stealing the $10 and $20 co-pays and got $700,000. So doctors are really worried about this. We're vulnerable. We tend to trust people. We don't really know what's going on, but we hear stories all the time. I've got a good buddy who had her entire retirement embezzled by her office manager, and it was gone before she even had a clue. So another benefit to outsourcing is the checks and balances. You get a chance to keep honest people honest.
That's a good way to put it. Well, let's see, I'm going to read this question here first. My city, this is from Isaac. He says, my city has at least 4 other medical billing companies. That's not many. there's probably 150 or 200 here in the Dallas-Fort Worth area. But he says, how do I compete against them and gain clients here and elsewhere? Well, Isaac, that's kind of an involved question. I would suggest that you get back with your ABS rep and really pin them down on that question. because it is a good question. What is it that makes you outstanding amongst all the other medical billing companies? Well, part of it is our technology, the fact that it does things that other systems don't do, but part of it is the fact that you are a part of a network of medical billing companies, the nation's largest network of medical billing companies when you become a part of ABS. And that positions you as way ahead of the competition that's out there. Look
May
at,
I take
yeah,
may
go
I
ahead.
take a stab at that too, Patrick?
Yeah.
Okay, I know it can feel intimidating. Oh my goodness, there's already 3 or 4. Is there enough business? Well, I would just invite you to take a look at how many plastic surgeons are there in town? How many internists are there? How many orthopedic surgeons are there? There are plenty, and the presence of competition is actually kind of good news for you because that means that that community is open to it. And you will learn how to market strategically. You will learn exactly who to focus on, and you're going to kind of find your tribe. And your tribe is probably completely different than any other competition there. So you're going to get the competitive edge in learning how to market effectively.
Yeah, and Isaac, one of the things that will make you stand out is that our staff does live demos of our system for doctors. Other medical billing companies probably don't do that. First of all, they probably don't have a cloud-based system. Even if they do, they don't know how to do a demo that sells the doctor on the fact that by using this technology and outsourcing their billing to you, and in conjunction with you using the electronic medical record system, they can increase their revenue. That's what they're looking for. Look, people don't care what they pay for something if they see the return on investment. And doctors don't mind outsourcing their billing and paying you 5, 6, 7, 8% of their revenue if they can see that bottom line you're going to bring in a whole lot more. Let's say you increased them from 30,000 a month to 40,000. That's $10,000 a month. I don't know about you, Dr. Vicki, but as a doctor, I wouldn't mind paying 7 or 8% of that extra $10,000 to somebody.
Ultimately, it's what you keep. And that's what doctors are worried about.
Yeah.
Hey, am I going to be able to send my kids to college? Am I going to keep my doors open? That's what they care about. And they don't want the heartache and the hassle. Like, simplifying their life is really important. They want to focus on patient care. And I guess that's the bottom line. They want to simplify things so that they can do what they love to do. They do not love doing insurance billing. This is a huge pain in the neck. They would prefer to just like have it taken care of.
And again, it's not their core competency. They weren't trained, and neither were their people. Probably, I asked people, where do you think the lady that's doing the billing for a doctor got her training? It was probably from the person before her, right? It's on the job training. And most of them have not gone to any kind of special training for doing medical billing. They just got in there. That was one of the tasks that they were told to do. They were shown a little bit about how to do it, and they just do it. They don't have any real incentive to collecting the maximum for the doctor because the pay is the same, whether they collect 30,000 or 40,000 a month, right? With you, it's different because you have a vested interest in that, and that's why doctors love paying a percentage of the revenue collected because they know you're going to collect as much as can.
Let me just add something else. Physicians know that experience counts. I just read an article that suggested that there are some hospitals that are going to restrict the privileges of doctors who only see a small volume of cases, let's say a complex surgical procedure, because they know that people who do something day in and day out get better results. They know intellectually that somebody who is working with revenue management day in and day out is going to do better than their office staff who they might have, sent to a 4-hour course about how to do this. They know this. And so if you can just frame it in terms of, doctor, if you had a patient with this complex medical condition, would you just send it to anyone around the corner? No, you'd go to a specialist. That's what we are. We're the specialists. We have experience. We know how to get this done.
Yeah, and they're not doing it just for this one doctor, but like you said, probably for at least a handful of other doctors. So you're right. That's their business. That's their focus all day long.
And they understand the value of that.
Yeah. Uh, Bill says, isn't it more expensive for a doctor to outsource their billing than just to do it with their own staff and software. So, Bill, perfect timing. I have a slide here I'm going to put up that we can kind of talk about this just for a moment. But what we did is we compared the in-house cost of billing to outsourcing to somebody like yourself. Let's take that first line, for example. Uh, Dr. Vicki, I think this is pretty reasonable. 400 claims a month for a doctor. Any doctor that's seeing less than 100 patients a week, something's wrong there, huh? And
They're a surgeon is the answer to that, Patrick.
oh yeah, that's right. They must be a surgeon if they're doing less than 100. And
Right.
then we did that times 12 to get a yearly figure. But if the average claim is about $100, and if you were only charging 6% of that, that would be 28,800 that the doctor would pay, to have his billing done outside. But internally, look what he's got to pay. Let's say for that kind of volume, you'd probably have to have 2 full-time billing employees at about $15 an hour. Then you've got payroll taxes, workers' comp insurance, errors and omission insurance, training costs, leave coverage, employee benefits, and your hardware, software, and IT support. It can mount up, as you can see, to huge numbers here. And so when you compare the two, no, it will always, always come out that the doctor could save money by just outsourcing it for a percentage. Hey, even if that was 8%, I don't know what that'd be, but anyway, it'd be just a little bit more than this, right? 35, 36,000, let's say. Still quite a bargain compared to what the doctor would be paying to manage all that themselves. Dr. Vicki, I had a doctor tell me himself that he spent 50,000 a year on this last line right here.
Yeah, absolutely. And even when doctors have invested in their electronic medical record, they're still changing because their old medical record didn't work for whatever reason. And so they're paying $50,000 to $100,000 plus the headache. When I got my new Mac, it was hard for me to update to my new Mac. Can you imagine what it's like to put in a new system? This is huge.
Yeah.
And doctors just hate this. I actually talked to a friend. They were upgrading their electronic medical record. She was told that she could only see 2 patients on Wednesday because all of the other resources were going to be spent upgrading the system.
Yeah,
It's a nightmare for doctors.
yeah, medical billing software, some of it is very expensive. I mean, they charge thousands of dollars for upgrades, to the software even. And then the new codes that come out, they have to upgrade the codes. They have to retrain their people when there's a lot of new features. Yeah, it's a headache for sure. Okay, here's an interesting report from the Doctor Patient Medical Association Foundation. Their report on doctors' attitudes on the future of medicine had some very key findings to it, but I picked this one out specifically because I thought it was interesting. 2 out of 3 doctors say that they're just squeaking by or in the red financially. That's shocking to me.
I'll harken back to that Shark Tank. Doctors don't care about money, and if you're not paying attention to the money, it just goes. So appearances can be deceiving. I remember I met some distant cousins. One of them, his dad was an orthopedic surgeon who had a successful practice, then went to law school and defended medical malpractice cases. He had everything. He had the mansion, the summer home, the yacht, the designer cars, the designer clothes. And he died suddenly, and everything was mortgaged. He hadn't saved anything.
Wow.
And unfortunately, there are so many doctors with this story. I mean, one of the articles that is really generating a lot of interest is the myth of the rich doctor. And you would be surprised if you pull back the curtains and seeing what's really happening. There are smart doctors who just have a very poor financial literacy, and they get into this situation. And you could be the person who turns it around for them.
Yeah, I read recently, Dr. Vicky, that the general practitioners used to make $300,000 a year. Now it's less than half that. Uh, so they're not as rich as people think that they are. They don't make the kind of money that they used to, at least.
Well, I think that there is still potential. And, I work with doctors all the time to try to figure out what this is. But the thing is, Patrick, if you are leaving 30% of your money on the table, yes, your income is going to go down.
Sure.
And if you're not sophisticated enough to take a look at where the money is going, you might not even identify that. I bet you have licensees with doctor clients who are absolutely astounded when they realize how much money they're walking away from.
Yeah. And how much more money that they're making once they turn it over, and outsource the billing. It's just amazing. I've got licensees that say that they are the doctor's best friend. I mean, they
Yes.
literally take them to their country club and they take them golfing. And one licensee got a free vacation from the doctor just because he was so grateful that they had increased his revenue by over $500,000 a year.
Yeah. And remember, so you're getting a percentage of that. I'd
That's
love to have 5-8% of $500,000.
right. Yes. Uh, This is an interesting quote. It's from the Healthcare Billing and Management Association. This is a big organization of medical billing companies that you can join. And as you can see, Brad Lund, I think he's the ex-president, but when we got this quote a year or so ago, he says, at no time in medical history has there been a greater need for expertise, technology, compliance assistance, and so forth. There is simply no entity in existence positioned to meet these needs better than the third-party medical billing companies. So it's the future, no doubt about it. Doctors are moving towards it. Guys, if you're looking at getting into a business of any kind, this is a pretty well positioned, and I don't think it's going to go away. Do you, Dr. Vicki?
I do not. And the other thing that I just want to interject here is that, the foundation of the American healthcare system is the doctor-patient relationship. I think doctors know that there is magic. Something magical happens within the context of the relationship, and they're willing to invest in that relationship. And you are offering a solution, but you're also offering this relationship. Doctors know that they're not on their own dealing with all of the uncertainties, and we don't know what's coming down the pike. We know the Affordable Care Act is here. It's probably here to stay.
Right.
But we don't know what that's going to mean for us. So having somebody in your corner, having a relationship with somebody that you trust, knowing that you're not in it alone, that has real value for doctors. And if a doctor doesn't value that, it's probably not the client that you want anyway.
Right.
But there are plenty of doctors who do value this relationship and are willing to invest in it.
Yeah, we mentioned earlier about the rejected claims. So I put this slide up here because people wonder if it's really true. But as you can see, folks, it's around a third of all the claims that are sent in are initially rejected from the insurers. Because as Dr. Vicki said earlier, they have a vested interest in keeping that money in their bank account, not paying it out, and they know that the doctors are not going to go back, probably don't have the staff or the expertise to go back and figure that out. On our system, just so everybody knows, compared to that 34%, we have a nationwide rejection rate of less than 2%. So when you can take that 34% down to 2%, there's a 30% increase in revenue, and we haven't even messed with the and improved the codes. So
I just want to tell you a little story. There was nothing that got hotter than having to call the insurance company. Like if I had a patient who needed to stay a day longer in the hospital, I would have to call the insurance company and get authorization. So my staff knew that there was nothing that could drive me crazier faster than having to get into the insurance company, talk to somebody who was maybe a high school graduate, and talk about these rejected claims. And I used to hear my staff on the phone trying to deal with it. And I mean, these were some things that our outsourced billers couldn't handle because maybe it was a new laparoscopic procedure or something. But it's crazy making. The value of having somebody else take care of that, like get it out of the office, was just huge.
now, Dr. Vicki, we were talking a couple of days ago, and you said something, and I don't have the pieces of the story put together, but something about the fact that you had decided to outsource and at some point hired a temp agency to bring in a person to do the billing.
Oh yeah, so when I got out of my surgical residency, I joined another physician in solo private practice, and he had his girl, that's what he called her. His girl Elise did everything. She did scheduling, she did billing, everything. Well, when I came on board, it sort of rubbed her the wrong way, apparently. And she decided to quit. And then the surgeon, in his great infinite wisdom, brought his wife in because, anyone can do this billing, right? It's just numbers.
Sure.
And she quickly discovered, like within a week, this is not easy. This is something that requires a true expert. And in the meanwhile, we had hired a temp to do the scheduling. And this woman was so nice and so gracious. She would even go out into the waiting room and help the elderly complete their paperwork. And we found out later that she was a convicted felon for Medicare fraud. So we had hired a felon basically from a temp agency. And I think that's always a concern, like, who do you trust? And so what do we doctors do? We turn to people we trust and say, who do we trust? So once you get your first client, when they're in the doctor's dining room, somebody else asks, who do you trust? What are you doing about this billing? They say, we are working with Patrick, and I'll tell you, things are great ever since we've outsourced it.
Well, that's one of the reasons when people complete our training here, we do certify them with a nice certificate they can frame on their wall as a certified revenue manager. In other words, a money manager for the doctor, not just a medical biller, because you're actually dealing with not only the insurance payments and Medicare payments, but also the patient revenue as well. We have an automated system to collect that money from the patients and let them pay it out over a period of time if they can't pay it all at once. So it's everything to do with that, again, that term revenue cycle inside that doctor's office. The Valerie says, how difficult and costly is it for a doctor to transition from their in-house system to the ABS system? But Dr. Vicki, let me kind of throw that to you. When you move from the system that you had there internally and then outsourced it, what kind of expenses are involved in that?
Well, my situation was a little unique. I was operating at two hospitals, and my non-base hospital formed this multidisciplinary group that I really wanted to be a part of. So I separated ways from this original physician, this original surgeon, and I set up my own practice. And just based on that experience, I decided there was no way I was going to do billing in-house. So I decided to outsource as I was doing the startup. And that turned out to be just a wonderful decision. So there's a lot of things that doctors have to think about when they're opening up a new practice or opening up a new branch of their practice. And if you do it at that time, it makes a whole lot of sense. Any transition is painful. If the hospital is implementing a new computer system and you need to access their labs, any transition is painful. And so I think that one of the things that really helps is if doctors know that there is somebody there, like there's a lifeline. You can call somebody. It's not their problem to deal with alone. And I think that eases the pain. So that's another piece of value that the licensees can offer.
Yeah, folks, like she said, any transition is going to be a painful, but we make it as easy as possible because with a cloud-based system, we're basically moving. Even their staff can use the online appointment scheduler, for example, by just using their current computer. If they have an internet connection in their office, which most of them do, they just simply log into our system. You give them the password and ID because you're the administrator of it, and you allow them to go into our system. So there are no user costs or anything like that. Now, there's some setup fees to get started, but that's all covered by the doctor. And usually for less than $1,000, the doctor can get up and running on our system fairly easily. Just depends on how involved, how many doctors there are in that office and so forth.
And let me say that doctors are forced into change. This upgrade to the ICD-10 is not elective. it's mandatory. So they are facing changes. And the question is, how can they minimize the wear and tear in making that change? And I think bringing in an expert who does this every day, I think it makes sense, and doctors understand that.
Yeah, Dr. Vicki, we didn't touch on this, but there is, a fear on the doctor's part at this point that they might be audited by Medicare, right?
Oh man, yes, this is huge. So for years and years, there'd been basically a gag order on Medicare. They were not allowed to disclose how much they paid which doctors. And this past year, as part of the Freedom of Information Act, this entire database was disclosed. So now you can go and you can find out how much your doctor got from Medicare last year. I immediately saw this, and my concern is that this is going to turn into a witch hunt. You know, the doctors who are making a fair amount of money are going to be targeted and audited, and this is something physicians fear more than a medical malpractice lawsuit, because at least in the court system, you're innocent until proven guilty. If you're investigated for unethical billing procedures, you're guilty unless you prove yourself innocent, which is almost impossible to do. So this week I saw that 2 of the top earners were being investigated. My concern is that more and more of these top physicians, these top 20% of physicians that get paid like 80% of the Medicare dollars, they've got a bullet on their back. And
Yeah.
I am concerned for them. And if they've got somebody dotting the I's and crossing the T's, making sure that everything is right, that's going to lower their risk for bad things happening. And I think doctors know this. We can see around the corner, and we understand that this will be more and more of a concern.
Yeah, and as you know, Dr. Vicki, one of the services that our licensees can offer to the doctors is a service called Audit Guard, which does an evaluation of the current doctor's practices in billing and looks at all the codes and makes sure that the doctor is not over coding, because that triggers those flags to Medicare. And if they come in, they could fine the doctor $10,000 per infraction. So it's very scary for a doctor. They could be easily put out of practice from just the fines alone.
Right, right. And so you offer so much value. You never really know what the buy button is going to be for a doctor. You know, one doctor might be really concerned about, am I going to be able to pay my kids' college tuition? Another might be really worried about, you know, fraud and being under scrutiny from Medicare. But the thing is that you've got a systemic solution that has a number of buy buttons here. So, you know, it's a lot of value that you're able to deliver to doctors.
Yeah, and you know what we love about our opportunity for licensees is that they can participate in all this with, our one-time, lifetime licensing fee. After that, there are no ongoing fees because we make money off of the transactions that come through on our end, and that's why we give them lifetime support. Well, Dr. Vicki, we're at the hour, so I'm going to let you go. Thank you so much for being a part of this today. I know that people love to hear from an actual physician and what your thoughts are on it, and you've shared some really good things for us today.
Well, it's my pleasure. Thanks for inviting me.
Thank you.
Bye-bye.
Bye-bye. And folks, I'm going to put our guarantee on the screen here and wrap it up with our next training class one more time if you'd like to know a little bit more about that. By the way, if for some reason you can't make that training class, it's okay, because we continue to do these webinars every Wednesday at 3 p.m. Central Time. And so you're welcome to come to these as long as you need to do all the research and find out all you can about this. We've been doing this for several years now, but we try to have new content each week so that you can learn the facts about it and make a good decision for you and your family. This is our guarantee. It's a 100% money back guarantee. If you don't like what you see when you come to our training workshop, at the end of the workshop, just tell somebody and we'll give you all of your money back. People ask us, how in the world do we do that? It's a long story, but the bottom line is that we've only done that for three times in our entire history. And that's because we know that we have something good. And by the end of the workshop, most people are thinking, why did we price it as low as we priced it? So if you want to come to that next workshop, now you got to get your paperwork in, because that is coming up here less than 4 weeks from now. And it's over half full now. You'll love what you see there. It's hands-on learning about we bring in laptops and teach you exactly how to do medical billing, beginning with the first day. And then, of course, we go into the details about how to get clients. And that's the most important part, of course, of any business. So I'm going to end it there, folks. Thank you for your questions. I see a lot of thank yous coming here from folks from Dr. Vicki, and somebody's asking how often we do those classes. By the way, this one is the next one coming up, but we do have one, I believe, in August, sometimes towards the end of August. You need to ask your ABS rep. It's not every month, but it's about every 6 weeks or so. So if you can't make this one, just plan on the next one. Well, thanks again for being with us today, folks. Let us know if there's any questions that we can answer for you. There's our toll-free number right there on the screen. I'll leave that there just for a second as we sign off. Bye for now.